Hi there. This video is a look at our updated weight template. This is part of our pathology module and the resources we provide there. So here I am in a test patient, and to access it, I would start with the pathology overview, this icon up here. And there's now a new button for weight when it's thought about it, available here next to BP, just because we're grouping together sort of OBS and then blood results separately. So here on weight, just to talk you through what information is here. First of all, at the top, in our view, we've got the kind of recent outcomes from weight or BMI. And for this particular patient, this test patient, we can see that they're eligible for the obesity 05 target, the weight management, including the weight loss injections. As ever, we try and provide kind of useful information here. So you can see the last three BMIs. If their ethnicity affects their BMI thresholds, that will be displayed here. We can see the last three weights and latest height. If they've been offered sort of weight management services and they've completed questionnaires, those would appear here. We've also included here if they've either got a GLP-1 on repeat or they've had it issued. If our system picks up any kind of contraindications for GLP-1, those would display here as well. Other codes that might be useful include eating disorder codes, malignancy codes, or bariatric surgery. And then we'll also show the consultation where weight was last recorded. That might be particularly useful if you're reviewing a low BMI and wanting to check whether that was discussed, or indeed whether raised BMI was discussed at the time. On the right-hand side, this top section is the same as all our other templates. So you've got two principal options. One is to say that the review's been complete. Some of these are standard, so we always have the kind of no further actions needed or discuss with the patient. You've also then got the referral's been declined. That's not a QOF code. We'll come to those separately in a minute. Referral not made due to a clinical decision. Again, that's not going to sort out QOF for you. Referral to weight management service, that is one of the QOF codes for obesity 4. You could use that. Separately, though, you've also got referral to eating disorders clinic. As with each of these, you then have to put some notes in here, and whatever notes are put in here, discussion re, op 05, offer, etc. Those would then appear here next time. In fact, I can even show you now. If I just OK this, and then come back into the template when it's finished thinking about it, close that one as well, and go back in. It will display what was recorded last time and the notes there. And the idea of that, particularly as patients potentially having annual bloods, OBS and things, and these might need to be reviewed annually for certain patients. We can see here the last review discussed with patient, and there are my notes. For these obesity 05 ones, you may well find that actually you want to invite patients in. So if I zero that off instead, I can then say that an appointment is needed. And we've got, again, similar to before, the kind of different options for who you might want to direct these to. If I pick that and I OK the template, it will also ask me if I want to send an invite. And if I do, it will also code that as one of the obesity management invites. Just to run through briefly the rest of the template, you've got the option to record and update someone's weight, height, and BMI. I can see here previous recordings. And then you've got these two kind of QOF outcomes. So one is to say that they have been referred. And this might be the place that you want to record when you've, say, done the referral to the NHS Digital Weight Management Programme or a local authority. The other options are also there. And we've put the principal exclusions. So it might be the patient's declined. If they've completed the questionnaire and they've said they don't want it, that code will have already been added. But you might want to do it on an individual patient basis like this. The other one that might be significant is if in your area certain services aren't available for patients. Finally, the kind of most significant new indicator, the obesity 05. Just to be clear that to achieve this, all three of these boxes need to be ticked. So shared decision making, referred to the wraparound support service, and the medication pathway has been started. It may be in time that we can put a bit more information in here. It may depend a lot on your own local services. as to how effective you can be with that. But yeah, to hit the QoF target, all three of those codes need to be added. A couple of options then, exclusions wise, unsuitable, informed dissent, the usual things. We've also added here bariatric surgery. We found that there are some bariatric surgery codes that aren't included in this QoF cluster. So clicking this will give you the option to add the relevant QoF code. We've also provided reports that highlight patients where it looks like they have had some kind of bariatric surgery in the past, but the code that's been added isn't one of these QoF codes. So you may want to look at that and consider either it might be appropriate for this indicator still, or it might be appropriate to change the code that's used. It's early days as I record this. Doubtless more work will be kind of put into this over the coming months, but this will be the basic sort of structure and outline, and we hope you find it helpful for these new targets. Thanks.